In 1799, Meriwether Lewis received a gift from his mentor. Thomas Jefferson was preparing Lewis for an expedition across the continent. Through unmapped territory, far from any physician, Lewis needed medicine. Benjamin Rush provided it. Rush gave Lewis instructions and a supply of pills. They were called thunderclappers. Each pill contained calomel, mercurous chloride, and hullup, a powerful purgative. The dosage was extreme. Modern estimates suggest a single pill contained several times the amount of mercury now considered toxic. Rush's instructions were simple. When illness struck, purge. The pills worked exactly as designed. They caused violent cramping, explosive diarrhea, vomiting that continued until nothing remained. The mercury triggered salivation, uncontrollable drooling, ulcerated gums, loosened teeth. Lewis administered the pills throughout the expedition, to himself, to his men, to Native Americans who came seeking medical help. Archaeologists later traced expedition campsites by mercury deposits in latrine areas. The thunderclappers left a chemical signature across the continent. Rush considered this good medicine. So did most physicians. For over 2,000 years, violently emptying the body was not a side effect, it was the treatment. The logic was coherent. The harm was extraordinary. Almost no one questioned it. Because the theory made sense, too much sense. Before germ theory, disease was not understood as invasion. It was understood as corruption. Something inside the body had gone wrong. The problem was internal. Food improperly digested, blood grown thick and stagnant, humors out of balance, too much of something that should not accumulate. Patients were described as foul, their blood corrupt, their systems loaded. This was not metaphor, it was diagnosis. Galen taught that health depended on balance. Blood, phlegm, yellow bile, black bile. When humors accumulated or putrefied, disease followed. The cure seemed obvious. Remove the excess, expel the corruption, open the passages. The body was understood as a system of passages: mouth, stomach, intestines. Health meant flow, illness meant obstruction. Obstruction demanded evacuation. Vomiting, diarrhea, sweating, bleeding, whatever opening was available. Treatments were combined: bleed the patient, make them vomit, purge the bowels, force sweating. The goal was total emptying. The experience was devastating. Emetics caused repeated vomiting. For hours. After the stomach emptied, bile came up. Then blood. Calomel worked more slowly. Then came cramping. Relentless diarrhea. Then mercury poisoning, salivation, ulcerated gums, loose teeth. Physicians called this the mercurial effect. They believed it proved success. If salivation stopped, the dose increased. The suffering was not failure. Sometimes it worked. Food poisoning is real. Emptying the stomach can help. Some patients improved. Most illnesses resolve on their own. If a purge was given before recovery, the conclusion was clear. The purge worked. Success was credited to treatment. Failure blamed on disease. The method was never tested against doing nothing. It was simply repeated. By the 18th century, purging became heroic medicine. Maximum doses. Repeated intervention. The physician as combatant. Benjamin Rush championed heroic depletion. He bled patients. He purged them. He blistered them. During epidemics, he treated until collapse. Patients came to expect violence from treatment. Rest appeared negligent. Visible suffering signaled seriousness. The severity of the intervention became proof of care. We now understand the damage. Severe dehydration followed. Electrolytes collapsed. Shock became common. Mercury caused organ failure. In 1799, George Washington fell ill. His physicians bled him repeatedly. They gave him calomel. They induced vomiting. He died within a day. The treatment likely hastened death. Purging survived because it allowed physicians to act. Doing nothing felt like abandonment. Action looked like care, especially when nothing inside the body could be measured. Medical schools taught purging. Patients demanded it. Physicians were praised for effort, not outcome. The system reinforced itself. We no longer prescribe mercury, but the instinct remains. Cleansing still appeals. Discomfort still signals progress. The purge did not disappear. It evolved.